Prevagen and Ginkgo biloba are both marketed for brain health and memory support, but they are quite different in terms of ingredients, scientific support, and how they work. The active ingredient in Prevagen is apoequarin, a protein originally found in jellyfish. It claims to support memory and brain function, particularly in aging adults. Studies funded by the manufacturer Quincy Bioscience claim benefits, but independent research and the FTC Federal Trade Commission have challenged the validity of these claims. Apoequarin is a protein, and there's skepticism because proteins are typically broken down in the digestive system and may not reach the brain intact. Prevagen is expensive relative to other supplements. The FTC has sued Quincy Bioscience for deceptive advertising. Ginkgo biloba is extracted from the leaves of the ginkgo tree. It claims to improve blood flow to the brain, helps with memory, focus, and sometimes anxiety. Some studies show modest cognitive benefits, particularly for older adults with mild cognitive impairment. Others show minimal to no benefit for healthy individuals. It is better studied than Prevagen, but results are mixed. Ginkgo biloba is inexpensive and widely available, and may cause side effects like headaches, dizziness, or interact with blood thinners. Which is better, Prevagen or Ginkgo biloba? And for evidence-based choice, Ginkgo biloba has more independent studies and a longer history of use. And if you're choosing based on cost and proven safety, Ginkgo is the more established and affordable option. If you're considering Prevagen, be cautious. Evidence is limited and the claims are controversial. Why take omega-3 fatty acids, EPA and DHA? DHA is critical for brain structure. Omega-3 may slow cognitive decline. How omega-3 helps memory and brain function? DHA supports brain structure. It is a major structural fat in the brain's gray matter and neurons. It helps maintain the fluidity and flexibility of brain cell membranes, which is crucial for memory and how brain cells communicate. DHA has anti-inflammatory effects. Chronic inflammation contributes to cognitive decline and Alzheimer's. Omega-3 reduces neuroinflammation and may protect brain tissue from age-related damage. EPA improves blood flow to the brain. EPA improves circulation, which may help deliver more oxygen and nutrients to brain cells. This supports mental clarity, attention, and memory. Omega-3 help protect neurons from oxidative stress and promote the formation of new brain connections, neuroplasticity. They may also help repair damaged neurons. Memory problems are often linked to depression or anxiety in older adults. Omega-3, especially EPA, have shown benefits for mood regulation, indirectly supporting memory. What does research show? In mild cognitive impairment, omega-3 can slow progression and improve memory performance. Some studies show improved working memory, processing speed, and recall in older adults. In regards to Alzheimer's disease, benefits are less clear once the disease is advanced, but they may still support overall brain health. Best omega-3 for memory, choose high-quality fish oil or algal oil for vegetarians. Look for at least 250 to 500 milligrams DHA per day, though up to 1,000 milligrams of DHA is often used in studies on memory. Combination with EPA is also important. Many products offer a 2-to-1 EPA-DHA or 1-to-1 ratio. Strongest evidence for early memory issues and brain aging. The typical dose is 1,000 to 2,000 mg day. Look for higher DHA content and choose purified fish oil to avoid mercury. B vitamins, B6, B9, folate, B12 deficiencies are common in older adults and linked to memory loss. Vitamin B complex may slow brain atrophy in those with high homocysteine levels. Methylated versions, e.g., methylfolate, methylcobalamin, are the best forms. Consider testing B12 levels first, especially for vegetarians or those on metformin. B-complex vitamins support brain health and memory by playing key roles in energy metabolism, neurotransmitter production, and protection against brain shrinkage and inflammation. Here's how each B vitamin contributes, especially in older adults. How does B-complex support memory? B1 thiamine is needed for converting glucose into energy in brain cells. Thiamine deficiency is linked to memory problems and neurological disorders like Wernicke-Korsakoff syndrome, especially in alcoholics. B6 pyridoxine helps make neurotransmitters like serotonin, dopamine, and GABA, which affect mood and memory. Low B6 may impair cognitive function and increase brain inflammation. B9 folate is crucial for DNA repair and methylation, which protects brain cells. Folate deficiency is associated with memory loss, brain fog, and increased risk of Alzheimer's. Use methylfolate 5-MTHF instead of folic acid for better absorption in seniors. B12 cobalamin maintains the myelin sheath around nerves and supports energy in brain cells. B12 deficiency is very common in older adults and can cause confusion, memory loss, and even dementia-like symptoms. It is best taken as methylcobalamin or sublingual B12 for better absorption. Why they matter together? B6, B9, and B12 work together to lower homocysteine, a chemical that damages blood vessels and brain tissue when elevated. High homocysteine is linked to brain shrinkage, stroke risk, and cognitive decline. A 2010 study in older adults with memory issues found that B6, B9, and B12 supplementation slowed brain shrinkage by up to 30% in areas linked to Alzheimer's disease. B-complex is especially helpful if you're deficient or have elevated homocysteine. Phosphatidylserine supports brain cell membranes and may improve memory, learning, and recall. Typical dose is 100 to 300 milligrams a day. Lion's mane mushroom promotes nerve growth factor NGF, important for brain repair. Small studies show improvement in memory and cognition. Typical dose is 500 to 1000 mg day of extract. Acetyl L-carnitine Alcar boosts energy metabolism in brain cells and may improve mental energy, memory, and mood in older adults. Typical dose is 500 to 2000 milligrams a day. Vitamin D plays a crucial role in memory and brain health in older adults, and deficiency is surprisingly common, especially in seniors who get little sun or have limited dietary intake. Here's how it helps. How vitamin D supports memory in the elderly. Vitamin D receptors are found throughout the brain, especially in areas involved in memory and cognition, like the hippocampus. It helps protect neurons from inflammation, oxidative stress, and damage. Chronic low-grade inflammation is linked to memory loss, Alzheimer's, and cognitive decline. Vitamin D modulates the immune response in the brain, reducing harmful inflammation. Vitamin D supports neurotransmitter function by helping regulate acetylcholine, a key neurotransmitter for memory and learning. It also influences dopamine and serotonin, which affect mood and motivation, both closely tied to memory. Studies show low vitamin D levels are associated with slower thinking, poorer memory recall, and higher risk of dementia and Alzheimer's. Older adults with low vitamin D, less than 20 nanograms ml, are more likely to experience cognitive decline. A 2015 study found seniors with deficiency had a 2 to 3 times higher risk of developing dementia. Why deficiency is common in seniors? A less sun exposure due to indoor living, thinner skin, and reduced ability to synthesize vitamin D, reduced kidney function, which affects vitamin D activation, and limited dietary intake. The recommended intake is 1000 to 2000 IU. Day is common, but ideal dosage depends on blood levels.